Good night, viewers, and welcome to tonight's edition of Living with COVID-19. I'm your host, Andre Pitts. Viewers, we're nearing the end of February and the start of what will be the final month in the first quarter of 2021. Last year this time, we were bracing for the inevitable arrival of COVID-19 into our country. And surely, it did come, and we had to stumble our way through COVID-19's ups and downs. 1 year later, we're still trying to get a good handle on it, but we have accepted that we will be living with COVID-19 for much longer. One person who is presently living with COVID-19 is Mr. Dorian Pickman, previously the sidekick on the nation's most informative and some would say entertaining COVID info bulletin. Tonight, Dorian joins us to share his experience being ill. Welcome to the show, Dorian.
Welcome, Andre. Well, it seems that I'm no expert. I got COVID.
How are you doing tonight?
I'm good. I'm recovering. So thank the Lord.
Okay, happy to hear that. And Dorian, we know that you're no longer working in the public sector and we haven't been seeing you on TV.
I guess I'm not talented enough, Andre.
Okay, well, Dorian, let's get into it. Kindly tell us about your COVID-19 experience and do you know how you became ill?
Well, the thing is, I contracted the virus more than likely in the United States. I happened to be in the US and I arrived back in Belize on the Saturday. And on the Saturday, I did the test at the rapid test at the airport. And they tell you, okay, well, we'll notify you, we'll give you a call if you indeed test positive for COVID. Until then, try to stay home, yada, 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 whatever. That's what I did. I received no call. That was on the Saturday. Then on the Tuesday, actually, is when I began experiencing symptoms. So given the incubation period of COVID, which is based on my reading, which is about approximately 5 to 6 days, more than likely I contracted it in the US, and that's the time frame between exposure to the virus and onset of the symptoms. So I returned to Belize on Saturday. I first got symptoms on the Tuesday. So within that time frame, so I'm guessing if you walk back 5 to 6 days from the Tuesday, I was in the US. So more than likely I'm pretty sure I contracted the virus in the US. And I mean, the amount of people in the US, it's really hard to specifically pinpoint exactly the moment where it is that you get the virus, unless of course you got the virus from being in contact with someone who you know previously had the virus or currently has the virus. That wasn't the case for me.
And so for the most, when you were in the US, were you wearing your face mask and using your hand sanitizers?
Oh yeah. I was wearing my face mask. I'm really meticulous when it comes to this sort of thing. I was really afraid of catching a virus. So I'm always, face mask, sanitizer. When I travel in the airport, I have the K95 mask, but I happen to be in 2 different cities in the US. I had to catch a flight 3 different times actually while I was over there. But I was wearing a KN95 mask. I have a little travel bottle of Lysol that I spray the seats down with, wipe the seats down and everything. But you never really know where you can get it. I mean, I tell people, like when you go into a store, for instance, you have a tendency to pick things up off the shelves and look at them. Somebody could have been there right before you who's infected with the virus and touched that right before you. So I try not to touch anything, but there are little things that you do subconsciously. You can touch something and before you get a chance to sanitize, your eye starts itching and you rub your eye, So it's really hard to determine exactly when I caught it, but I thought I was being pretty careful.
Okay, and so what are the different symptoms that you began to experience on the Tuesday after returning home?
The Tuesday evening, I actually came down with the fever, slight fever. I got body aches, extreme body aches, like the muscles in my lower back were hurting, my arms, my legs, my joints, my knees, everything was hurting. And then I had like a slight fever. At that point, I was hoping it was just the regular flu, being that we're in the middle of flu season already, as is, it could have been the regular flu. A couple weeks prior, I was experiencing some symptoms as far as like runny nose and stuff like that, which turned out to be allergies. So I was thinking maybe this might be a regular flu. And then like I started reading up on COVID, like the difference between the flu and between COVID. You know, with COVID, you have a dry cough. With the flu, you have a wet cough, more mucus. And that's what I was experiencing.
Okay.
So I said, you know what, I'm not going to take any chances. So I just, you know, that evening, you know, I said, well, I'll see how I feel in the morning. Because for the past year, I've been dealing with psychosomatic symptoms. Every time I hear somebody has COVID, my throat starts to tickle, my head starts to hurt, you know. So, and then the next day I wake up, I'm fine. I woke up the Wednesday morning and that wasn't the case. The fever was still there. The aches are still there. So I was speaking to my landlord, my friend, and she goes, you know, you got COVID. And I'm like, nah, it's just a regular flu. Let's see how it is. She's like, Breds, you have COVID. Like, those are the symptoms of COVID. I'm like, well, we'll see. Let me sleep it off one more day, whatever. And then the Thursday, I still felt, you know, I still felt that slight fever and stuff. So I said, you know what, I'm going to go get tested. And I went and got tested, and lo and behold, positive.
And Dorian, I'm curious, what were your initial reactions when you went to get your private rapid test and found out that you indeed had COVID-19?
Well, I already had my mind made up that there's a strong possibility that I have COVID-19, given the symptoms. And, you know, when you look, you know, you're always Googling stuff and like, you know, and I've been doing that, like I said, for the past year. So I know all the symptoms. So when I looked at it, I mean, there wasn't that moment of truth. Like I just ripped it open, like let's get it over with. Looked at it, positive, wonderful, okay, great. Immediately, I came home. I know the routine, got a quarantine. I initially told just a couple people, the people who I was around, like within that time frame.
Okay.
Because when I was in the U.S., I was traveling with three or four other friends. So. You know, like, yo, you guys, and, you know, one of them, me and him were sharing a room. And like, you guys, you know, I'm tested positive. What about you guys? So, you know, immediately, you know, they went into a panic or whatever. They tested, thankfully. None of them tested positive. I was, the Monday I went to Belmopan with a friend of mine as well. We were in the same vehicle I was driving. So I notified him. He was like, okay, well, I'm going to chill and see if I have any symptoms. To this date, no symptoms, thankfully good, so he's good. Another friend of mine, I was at his house actually the morning when I came down with symptoms. And he has an elderly mother, which I was a bit concerned about as well. I mean, I'd feel entirely guilty knowing that I transmitted the virus to someone, especially an elderly person who's high risk. Thankfully, none of them, they self-isolated or whatever, and thankfully none of them. So it doesn't seem that I spread the virus to anyone. But I came home and I'm like, okay, well, I have COVID. I told a couple people, and then I started getting these texts, like, you know, from a bunch of other people, like, oh, is it true that you have COVID? Is it true? I'm like, bad news travels fast, and you know. I was forwarding some messages from different group texts when they're like, watch my even if I ask the experts, I know he have COVID. Just because I was on a show advocating for better health measures and trying to help people be safe doesn't mean that I'm immune to COVID. This disease is 100% non-discriminatory.
That's right.
And it's no scarlet letter. There's no shame in having COVID. You know, I contracted COVID. Okay, you know, hey, it got me. So now it's just a matter of doing what I have to do.
And how have you managed your symptoms at home? Have you bought into the different teas that people have been promoting?
You know what? Like, okay, so initially, I called my landlord right away, and they're like, well, you know what? You're right. I have COVID. So she's like, okay, don't worry, sit tight. I'm gonna contact the doctor or whatever. So she contacted the doctor and like, okay, well, my friend has COVID or whatever. So he like wrote a prescription and everything. She got it fulfilled for me. You know, she pulled up, dropped it on my veranda, left it out there, like, okay, go get your medicine and everything like that. So I did get prescribed some medication. And I'll tell you, some of that medication really, really helped, especially the cough syrup. That was golden. I mean, without that, I probably would have choked on my own mucus so many times.
Yeah.
But and then, you know, I had a bevy of friends who sent me stuff and everything like that. My aunt sent me some, you know, that mix up COVID juice. I got some fever grass and stuff like that. So I was using all of that stuff, and I have to say, I have to say, thanks to all the people that reached out and helped me in my time. I mean, Dr. Manza reached out to me. I was a bit starstruck. I was like, wow, the hero, the champion of COVID, you know, the legendary Dr. Manza, he reached out to me. And he goes, you know, Dorian, I heard you have COVID. If you need anything, just don't hesitate to reach out to me. I can share my experience with you. And, you know, I can give you advice. Make sure you stay hydrated. And then, well, actually, his first word of advice is no cigars, Dorian. You can't smoke any cigars. At that point, I knew his advice wasn't going to work for me. So I was like, okay, thanks, Doc. Whatever. I'm kidding. I'm kidding. But he, you know, so I had to, you know, of course, I wasn't smoking any cigars at that point. And Dr. Hidalgo, too, I'd like to say a huge thank you to. And Dr. Hidalgo, knowing that I contracted the virus in the U.S., he was concerned that there's a possibility that I might have contracted a mutated strain of the virus that's been going around in the U.S. So for him, he really wanted to monitor my symptoms to see if there was any variance in terms of what he's accustomed to seeing with symptoms with people with COVID here in Belize. So he was a big help.
Well, Dorian, you've gone from ask the experts to ask the patients. So before you leave us this evening, do you have any final word of advice to our viewers who may find themselves in your same position?
It's really a matter of being diligent about, you know, hand washing. It's really hard to avoid, but there are mitigating factors, things that you can do to lessen the chance of you contracting the virus. Let me tell you, this is no ordinary flu. It was very rough on me. It was very, very rough. I mean, going to the bathroom, getting up to go to the bathroom, I was extremely weak. I'm walking like a decrepit old man just to get to the toilet. It was, thankfully, I didn't have the breathing problems. I had a couple scares. But thankfully, I was able to stay out of the hospital and recover here on my own. But it's just a matter of just, like I said, being diligent in washing your hands, watching what you're touching. Physical distancing is a big part of it too, because like, for instance, I contracted the virus and I was around a few people. Thankfully, they didn't contract the virus as well. But there's a strong possibility that somebody could have, and I would have felt extremely guilty, you know? So physical distancing, and a lot of times you get very comfortable, and especially that we're not seeing the amount of deaths that we saw in the past couple months. We're very comfortable. We've gotten extremely comfortable, and we can't. And when we're looking at the rates of recovery to the rates of infection, and it looks like pretty soon we'll have negative infections in Belize, the way that people are recovering faster than they're reporting the infections, it leads to a false sense of security, and we don't want to fall into that trap because a third wave is coming, it's imminent. You know, so I just implore people to really wash your hands, physical distance, be careful of your surroundings, where you're going, and as much as you can, just, you know, stay in and try to be safe, wear your mask at all times, you know? All
right, well, thanks a million, Dorian. You're sounding indeed like an expert, and we appreciate all that you
Finally, I'm an expert. Before I only asked the experts, but now I'm an expert. So it seems I have a little bit. COVID gave me some talent.
Excellent. Well, viewers, we just heard from Dorian. He shared with us his COVID-19 experiences, and he's well on the way to recovery, as he has reported, and so we're very happy to hear that. Living with COVID-19 viewers, we'll take our first ad break now, but we'll be right back, so kindly stay tuned. night and welcome back to Living with COVID-19. Viewers, most of you may recall the complications involved with the reopening of the international airport and the health requirements for visitors to prove their COVID positive status. Well, now, even the countries that most of our visitors come from are now requiring COVID negative test results. This has led to a boom of service providers offering the COVID-19 rapid test. One of the newest bodies doing so is Caring Hands in partnership with Maya Island Air. And joining us to discuss this business is their owner, Dr. Shana Pat. Doctora, welcome to our show.
Hi, Andre. Thank you for having me.
Thanks for joining us. How are you this evening?
I'm doing well. And yourself?
I'm doing fine as well. I'm interested to know, Doc, how consuming has this pandemic been for you as one of the frontline medical professionals?
Well, I'd have to say that I've been more busy than usual. Less personal time for sure. And I believe that I've dedicated myself to the fight against COVID. Since the very beginning of the pandemic and it reaching our borders, we've had to make a lot of changes in the healthcare system. And so, yes, I've participated through, I would say, all phases of attending to COVID-19 patients, testing, examination, and attending to patients in our isolation ward, from mild to very, very critical patients. And, we have definitely suffered some losses. And so, of course, it's been quite consuming. And my life, as we all know it, has changed significantly. But it is what it is, and we've had to step up to the plate and do what is necessary to combat this very, very
taxing pandemic.
Yeah.
Well, we're happy to know that you remain in high spirits and continue to be dedicated to the job. So congrats on that. And now you're acting again on the front line in another capacity with your business venture, Caring Hands. Can you tell us what motivates you to start your own medical center to provide these rapid tests?
Okay, well, when the CDC requirements came into place, I was approached by the CEO of Maya Island Air, Mr. Chris Sosa, and he was very concerned about their travelers and as a nation, we've taken a huge loss, as so many other countries, and we're trying to do everything possible to get tourism back afloat in the safest way possible. So this was a way for me to contribute to that as well. It is also a business opportunity, of course. And Maya Island Air has facilitated, their buildings. They've donated their buildings to this venture, and assisted in just about everything. And It's been a great partnership. But it all came into place when, like I said, I was approached by Mr. Sosa, who saw me qualified to carry out this task.
And can you tell us a bit about how exactly the rapid tests work?
Okay, well, we carry FDA-approved rapid test kits, which are very accurate. I think it's 97% accuracy. And it's very quick, very straightforward. The patient comes in, we take their information that's needed for their report, and then they move on to being swabbed. Once they're swabbed, the result is run, the kit is run, and it takes about 15 minutes after their swab to get the results.
Okay, so rapid indeed.
Yes, very fast. And
Okay.
being at the airports, it's very convenient.
Okay, and what has the demand been like so far?
Well, I mean, tourism is not where we want it to be, but it has steadily picked up over some time. I'd like to state also that we're not just open for tourists, but also for Belizeans who need to be tested.
Okay, and so if they live near one of the airports or municipal airstrips, it's convenient for them to just run over there to get their rapid test.
Yes, we're located. Currently, we have offices in San Pedro, Belize City, Placencia, and Dangriga, and currently working on Hopkins.
Good, so they expand rapidly. That's great. And I also want to hear from you. How important do you believe these rapid tests are locally for us to help contain the spread of this disease, and also in terms of the economy to ensure that our tourism industry, whatever it means, can continue to be viable?
Yes, well, I believe that testing is the most important thing. That's the only way that you will know what your status is. So we've had many asymptomatic cases, and these are the people who are more likely to spread COVID-19 in the community because they don't even know that they're sick. So I believe that testing is, of course, most important in this pandemic, to combat this pandemic, because once you know, then you can be quarantined. If you need treatment, whatever comes after that.
Yeah.
But of course, the testing and broadening of testing over through the country and facilitating testing. The testing is easy, not just if you have symptoms.
Yeah.
Like when we first started and testing was so hard, and we were only doing the PCR and just central lab, so it was harder for people to get tested and to even get their results. So you're waiting for your results and you don't really know your status.
Yeah.
And so testing is most important.
Well, we're very happy that you have offered your professional competency in this new capacity, and we hope that your business venture continues to be successful, Doc. And if possible, we would love to have you back on our show soon to talk about your other COVID-19 experiences in the hospital, of course, if you have time.
Sure, Andre. Sure. Thank you very much.
No, thank you very much for coming. And on behalf of all our viewers and our team, we want you to keep up all the good work that you have been doing.
Thank you.
Good. Well, we just heard there from Dr. Pat, the owner of Caring Hands, and they have recently started to conduct the COVID-19 rapid tests at the different municipal airports across the country. Well, they'll soon cover all of them, and that has been helping a lot with helping us to contain the spread of COVID-19 and to also keep tourists comfortable and safe, that they can come to Belize safely and return home with as least amount of hassle as possible. But viewers, that's just about it for our time with you tonight. Living with COVID-19 will be back again next Monday at 7 p.m. right here on CBTV and also on our Facebook page, Colorblind Multimedia. Until we return again and have you back, do remember to stay informed, stay healthy, and stay safe. Good night and take care.